Without treatment, cartilage defects of the hip are at risk for getting worse. Early treatment includes non-operative methods like physical therapy, activity modification, NSAID medication, and injections into the hip. While these treatments can help manage symptoms, they do not fix the underlying cause. If non-operative treatment does not provide lasting symptom relief, surgery may be considered for certain cases. These include cartilage defects at one specific area, pain that is difficult to control, recurring swelling, loose bodies, and symptoms like clicking and locking. However, not all cases can benefit from cartilage defect surgery. These include widespread cartilage damage as seen in osteoarthritis and hip alignment problems. Other surgical procedures are usually needed to address these issues. Surgery may also not be appropriate if there are other conditions like inflammatory forms of arthritis or morbid obesity that affect the ability of cartilage to heal. Surgical treatment will vary depending on the cartilage defect location, size, and physical demands of the patient. Articular cartilage has a limited blood supply, so it has a limited ability to heal on its own. Different procedures are available to try to preserve or restore the cartilage. These include chondroplasty, where the damaged cartilage is smoothed out, marrow stimulation, where small holes are drilled into the underlying bone to stimulate healing, an OATS procedure, where a graft of cartilage and bone is taken from a donor and placed into the cartilage defect, and cartilage transplantation, where small pieces of cartilage are removed from the patient's own hip or taken from a donor and transferred into the cartilage defect. Many procedures can be performed through arthroscopy with small incisions around the hip, but larger cartilage defects may require an open incision. During surgery, a patient may be positioned on their side or on their back, depending on if the procedure is open or arthroscopic. Their leg may be positioned in a leg holder that applies a slight pulling force so that the surgeon can access the inner surfaces of the hip joint. Fluoroscopy may also be used where X-rays are taken continuously to help guide the procedure. The decision to undergo surgery should be made through a discussion between the patient and healthcare provider to go over potential risks and benefits of an operation. Things to take into consideration following surgery include weight-bearing restrictions, need for extended rehabilitation, and the risk of surgery having to be redone due to unsuccessful outcomes. Rehabilitation after surgery will depend on the procedure performed and the surgeon's preference. Typically, there is an initial period of non-weight bearing where a patient will need to use crutches or another assistive device to stay off of the operated hip, followed by a gradual increase in weight bearing and physical activity over several weeks to months.